Hi, I'm Steve Federico. I'm the Director of General Pediatrics at Denver Health, and am excited to share some great news with you today. One of the pieces of great news to share with you is that the rates of COVID in our community have started to go down again, and those rates have sustainably gone down. And perhaps most important to this audience, the rates among school-age kids have started to go down. One of the reasons that those rates have started to go down is because it is clear to us from the data that parents are increasingly getting vaccinated. So the vaccination rates for people in Denver between the ages of 30 and 40 and between the ages of 40 and 50 have gone up significantly in the last few weeks, close to 60% of the population in those age groups having received at least one vaccination. So great news this week. The FDA has approved the COVID vaccine, specifically the Pfizer COVID vaccine, for adolescents between the ages of 12 and 15. Previously, we've only been able to vaccinate those 16 and older. Kudos to our Denver community because currently 45% of 16 and 17-year-olds have already received at least one vaccine. Now we move into the next phase, which is to continue to vaccinate 16 and 17-year-olds, get them their second dose, and start to vaccinate the 12 to 15-year-olds. This is going to make a huge impact on the number of cases in our adolescent population, which is going to have a huge positive impact on our schools. Many fewer cases in our schools, many fewer quarantines, much more predictability in our schools if we can reach out and get those 12 to 15-year-olds vaccinated. We anticipate being able to do that beginning this weekend. So there's one final step that has to happen. The CDC is meeting on Wednesday. We anticipate an approval from the CDC, which will then allow delivery systems such as Denver Health to start vaccinating and putting shots in arms in 12 to 15-year-olds. Super excited. As a pediatrician and as a DPS parent, I am incredibly excited that we can now vaccinate all of our adolescent population from the ages of 12 and up. Why am I excited? I'm excited because it is increasingly clear that these are great vaccines at our disposal. They really work. They prevent disease, which then prevents transmission. And in the rare case that someone gets infected after the vaccine, their illness is much, much, much less severe. The second reason we're excited is because as more and more people get vaccinated, especially teenagers and parents, the more likely we are to have a school year next year that looks like school used to look like before the pandemic. So our planning around next school year has everything to do with how much our teenagers and their families get vaccinated this summer. And that starts this weekend. So I hope you'll join me and my family in getting vaccinated in the coming days and weeks so that we can return to normal school operations next school year.